Hey guys, today we're going to talk about a very common orthopedic condition that we see in the clinic called carpal tunnel syndrome. This is the prayer stretch. So this is a great way to get bilateral wrist flexor stretch in the forearms. What you're going to do is you're going to take your hands together and then you're going to drop your hands down as the elbows come out until you feel a good stretch in both forearms. We're going to hold it for 2 to 3 rounds of about 30 seconds. So you're kind of pushing your hands together to generate a little bit of force here. We want to kind of push with a sub-painful amount of force. So this should not be causing symptoms, but we should definitely be feeling the stretch here. So this is called the prayer stretch. We're going to go for 2 to 3 rounds of about 30 seconds. This is the wrist extensor mobilization in quadruped. You're going to sit up in the hands and knees position. And what you're going to do is you're slow and controlled going to rock forward and then rock back. So a couple reasons why I love this exercise for carpal tunnel syndrome. So number one, a lot of my patients talk to me about pain with weight bearing. So they have pain either doing yoga, doing push-ups, or just getting on and off the floor, anything that requires weight bearing. And this position can kind of really help us build exposure and build resiliency into that weight bearing position in such a controlled manner. Number two is it can get us into a deeper wrist extension position. Because we're adding that weight bearing through it, it allows us to add a little extra force into that wrist extension. So a typical kind of set and rep scheme here is about 2 to 3 rounds, about 10 to 12 repetitions. So a couple things to note, you'll see I'm keeping those fingers straight. And I'm just kind of rocking forward until my wrists are really kind of far extended, but I'm not pushing through any pain barriers here. I'm kind of listening to where my end range is, and then I'm coming back. Okay, 2 to 3 rounds, about 10 to 12 repetitions. If you can't find a deep enough stretch in that position, sometimes some people can kind of find a deeper position if they turn their hands the other way and rock back like that. So this is definitely an advancement of that exercise, and my wrists are maybe not quite mobile enough to kind of get into that position, but some folks can kind of find a little bit of a deeper stretch if they turn the hands back. Okay, so that's the wrist extensor mobilization in quadruped. This is the banded horizontal abduction. This is a great way to work on some of the up the chain issues with carpal tunnel syndrome for those postural mechanics. You're going to hold a band with your thumbs facing up and elbows out straight. You're going to keep your neck in a neutral position and you're going to open the band straight up and back together, pinching the shoulder blades together as we open. Going for about 10 to 12 repetitions here, about 3 sets through. This is the banded horizontal abduction. This is the banded wrist extension exercise. You're going to make sure that your elbow is well supported, and you're going to grab a band. You're going to step on the bottom of the band with the same side as the working upper extremity. You're going to let the wrist kind of curl down into flexion, and then you're going to turn all the way up into extension. So here to here. It's important that we make sure our elbow stays grounded here so that we're not compensating through our elbow. If you do not have a band, you can also use a light weight for this. Sometimes if my patients don't have a band or a weight at home, I have them fill up a water bottle or like hold a can of beans or something like that to add a little external load. The typical kind of set and rep scheme here is about 2 to 3 sets of 10 to 12 repetitions. This is the banded wrist extension exercise. This is the forearm pronation and supination exercise. You're going to grab your TheraBar. You're going to want to load it up pretty heavy for this one. You're going to hold it at first, both palms facing down, and you're going to turn your palms down as if you're trying to make it like a rainbow shape. So here to here, okay? And we're going for about 10 to 12 repetitions. Once we get 10 to 12 repetitions, we're going to turn our palms up and go into pronation, or making it look like a U shape, okay? So the first one, we're kind of going into this position called supination at the elbow for about 10 to 12 repetitions, or making it look like a rainbow shape at the TheraBar. The second position is called elbow pronation, where we're making it look like a U, okay? 2 to 3 rounds of 10 to 12 each. If you don't have a TheraBar, another good option is actually with a hammer. So you're going to take a hammer, and I love the hammers for these because they're very top heavy, and so it allows us to get into a little bit deeper load since it's top heavy. And you're going to have your elbow supported, and what you're going to do is you're going to allow the weight of the hammer to pull your arm one way and then turn your wrist to the other direction. Really important here to make sure that your elbow stays grounded, that we're just getting that motion through the wrist and through the forearm. This is called elbow supination and pronation. We're going for 2 to 3 rounds, about 10 to 12 repetitions each. The TheraBar is a great option for this, but if you're in a pinch and don't have one, the hammer can also work.